Good morning, Dr. Andy Kirshner here. Thank you for visiting me here at the Backwards blog at backtogether.org. Today I'm going to take a break from our fibromyalgia series and respond to a viewer question that I got from down under in Australia. The letter reads, "G'day, Dr. Kirshner." I just love letters that start with "G'day." Then I know it's from Australia. "I'm Karen from Sydney, Australia, and I'm having a hard time trying to find out what the name of the surgery would be called that I need to have and how it would be done, etc. To let you know what's happening," and she quotes from what I believe is an MRI report, "C5-6 posterior disc osteophyte bar eccentric to the left, causing effacement of the CSF planes and flattening of the cord. There is severe narrowing of the left neural exit foramina. C5-C6, there is broad-based posterior disc osteophyte eccentric to the right, causing effacement of the CSF planes, and there is moderate narrowing of the right neural exit foramina." Now she relates that I get numb arms, hands, fingers, and pins with needles. I can't get my arms above my head without being in a lot of pain. I have constant pain in my neck and shoulders and down the outside of my arm 24 hours a day, 7 days a week. I've been told that I have fibromyalgia as well. T8 height reduction, 15%, lumbar scoliosis, cervical thoracic lumbar spondylosis, osteoarthritis is throughout my body, and I've been getting worse since I was in my late 20s and early 30s. I've been told about having neck surgery to relieve the pressure and pain on my cord, but no one will tell me exactly what it's called, how it's done, what the risks are, and what the recovery time is. I was Googling and came across your info and videos, but I couldn't see one that looked like something that I need done. So she's asking basically what the surgery that she needs is. Now, I get lots of questions where people are asking me what procedures they should have done. Now, first of all, let me preface this with this disclaimer. Without actually examining you and looking at your films, it's hard for me to say exactly what it is that you need. But based on what your MRI report tells me and the symptoms that you related, I can at least give you some idea. Now, based on what you're telling me, it looks like there may be two procedures involved. One would be a foraminotomy, and the other one might be a microdiscectomy. Now again, I'm just saying this without looking at your MRI. The foraminotomy is a procedure where a surgeon goes in with some small tools and actually bores out the exit foramina, that's the small hole that the nerve exits your spine from, and relieves the pressure on it, and that would hopefully get rid of some of the numbness and tingling. The microdiscectomy is where they take the part of the disc that's bulging out and pressing against your spinal cord, and they remove the part that's actually sticking out and surgically create a scar which will hold the rest of the disc in place. Now again, this is just based on the information that I have in front of me. Now, as for the fibromyalgia, that's a tough call. If you've been looking at my series on fibromyalgia, it's a very specific diagnosis. You have to have 11 of 17 classic trigger points to be identified with fibromyalgia. It doesn't affect joints, and there's a whole host of other symptoms that go along with it. So based on what you're telling me, I can't say one way or another whether you have fibromyalgia. As for the surgical risks, any sort of neurosurgery comes with all the risks that go with any surgery, and that's infection, blood clots, etc., all the things that go along with any surgical procedure. Neurosurgical procedures set up an entire separate set of problems in the possibility that you could have worse nerve impingement than you had before, and in the worst case scenario, some patients can wind up with paralysis, although this is very unlikely. The statistics for foraminotomy are actually better than they are for most spinal surgeries, so if that's what you're looking at, your outcome may be very good. But again, I'm going to keep throwing this disclaimer out there. Without examining you, I couldn't really say for sure. I hope this answers some of your questions, and I hope you'll follow up with any further information that you'd like to send me, and let us know what you do and what you come up with. And if you decide to go ahead with the surgery, let me know. Good day, and thanks for joining me here at the Backwards blog. Look forward to hearing from you soon. Keep those cards and letters coming, because that's what keeps the blog interesting. Thanks for joining me.